Closing the fallopian tubes. One of the important parts of the female reproductive system that plays an important role in fertility is the fallopian tube. This section includes two simple tubes that are located on both sides of the upper part of the uterus and lead from the uterus to the ovaries. One of the contraceptive methods that is considered a permanent method is closing these tubes, which is also called tubectomy. Female sterilization or tubal ligation is a surgical procedure that is performed to permanently prevent pregnancy. In this procedure, the fallopian tubes are closed. When women decide not to have any more children, using this method can be a suitable way for this purpose. This operation is slightly more complicated and expensive than male sterilization, vasectomy. Female sterilization is the most common method in developing countries. Women who are between the ages of 40 and 44 use this method to prevent pregnancy more than women in other age groups. Approximately 51% of these women consider having a tubal ligation to prevent pregnancy. Who can have their fallopian tubes closed? If it is dangerous for you to get pregnant. If you have as many children as you want. If you cannot use other methods of contraception. Women who are not at all interested in having children. If the probability that you are a carrier of dangerous genetic diseases is high. Benefits of tubal ligation. Fallopian tube ligation almost always results in lifelong infertility. This is a very safe method of preventing pregnancy. Tying the tubes may also help prevent a dangerous infection called pelvic inflammatory disease. You don't need to take pills every day or get injections to control it. A cheap way. Permanent contraception. Its quick effect after surgery. No disruption in sexual activities. It reduces the incidence of ovarian cancer. Not causing special complications for a person's health in the long term. No need for long-term hospitalization and daily care. Preventing the occurrence of dangerous infections called pelvic inflammatory disease. Accompanied by closing the fallopian tubes. It requires surgery. It does not prevent the transmission of sexual and infectious diseases. This method does not prevent the transmission of sexually transmitted diseases in people. If the patient regrets it, it is not possible to open the tubes and it will be very difficult and expensive to try to open the tubes again. In which case should not be performed surgery to close the uterine tubes. Infectious abortion. Suffering from pelvic cancer. History of obesity and diabetes. Has a history of acute heart disease. Having active sexually transmitted diseases. Unnecessary bleeding from the vagina. Have a history of abdominal and pelvic surgery. It is not done for 7 to 42 days after giving birth. The person has pelvic inflammatory diseases in the last 3 months. Having problems during pregnancy, delivery and after delivery, such as eclampsia, severe pre-eclampsia, rupture of the water sac, fever during delivery or immediately after, bleeding and infection of other parts of the body after delivery. Surgical methods to close the fallopian tubes. Laparotomy. Laparoscopy. Hysterectomy. Coldoscopy. Hysteroscopy. Mini-laparotomy. Possible complications of tubal ligation. The operation is usually without complications, but if any of the following occurs, you should see a specialist. Diarrhea. Fever above 38 degrees. Get infected or bleed. Disturbances in the menstrual cycle. Severe lethargy and fainting. Spotting and heavy bleeding from the vagina. Creating scar tissue in the organs inside the pelvis. Causing abdominal pain that increases over time. Injury to internal organs, glands or blood vessels. The presence of pain and swelling at the place of the suture and the discharge of pus and blood. Block the entry of a blood clot into the blood streams and vessels of the lungs, pelvis or legs. Post-operative care of tubal ligation. Daily bathing. Keeping the suture site clean and dry. Taking medications prescribed by a specialist. Absolute rest for 2 to 3 days after the operation. Abstaining from sexual activity for at least a week. For a week, one's activities should be light. People whose surgery was performed through the vagina should not do anything inside their vagina for 2 weeks to prevent infection. How to close the fallopian tubes in laparoscopic surgery. Laparoscopy is one of the common surgical methods to close the fallopian tubes. When pregnancy is accompanied by risks or you do not want to have a new child, among the methods of preventing pregnancy, the method of preventing the closing of the fallopian tubes is a permanent method to prevent pregnancy. Closing the fallopian tubes laparoscopically can be done under both general anesthesia and spinal anesthesia on the patient. In laparoscopy, the abdomen is filled with carbon dioxide gas until the abdominal wall is separated from the uterus and internal organs, and the surgeon makes 2 small incisions, one for the entry of the laparoscope and the other for closing the patient's uterine tubes. This operation is much more complicated and difficult than vasectomy in men, so it is recommended that the patient rest for 1 to 3 days after the operation. Another method of closing the fallopian tubes is during cesarean section, which the doctor can do at the request of the patient or close the fallopian tubes through the vagina. Golden tips. Before the operation, necessary tests such as blood test, pelvic examination, Pap smear test should be performed. You must inform your surgeon if you have a specific disease or are taking a specific medication. In case of general anesthesia, you should not eat anything for at least 8 hours before surgery. Take a bath the night before the procedure. After the operation, you can take a bath every day, but you must dry the stitches completely. After this surgery, you should drink plenty of water, vegetables, and fiber-rich foods to avoid constipation, as constipation puts pressure on the abdomen and stitches.